This community briefing. Joining us once again to provide interpretation is Margie Propp. Thank you so much. And thank you all for tuning in to learn more about the latest local developments, about how to keep yourself and your loved ones safe, and how to help end this pandemic. As our successful vaccination efforts move forward, the public health professionals at our Lincoln Lancaster County Health Department continue to demonstrate their knowledge, experience, and dedication every day. We are on track as we move into Phase 2A, and we continue to receive wonderful feedback about the operation of our large-scale vaccination clinics. Thank you to all those who have provided that feedback about your experiences in our clinics. Your kind words, notes, phone calls, and posts fuel our volunteers and staff through very long clinic shifts. And in addition to the great feedback that we are hearing from the public about the success of our clinics, we have the data to demonstrate that our local vaccination program is contributing to the lower case numbers and fewer local hospitalizations that we have witnessed in Lincoln and Lancaster County since we administered our first doses back in late December. Seniors have been a top priority for vaccinations given their relative vulnerability to the virus and its most severe impacts. So we are also very pleased to share that we have now vaccinated over 75% of Lancaster County residents age 65 and older. This is vital progress that would have been so difficult to imagine just over 3.5 months ago when we weren't even sure if vaccines would be approved and available to help us in this fight. Ultimately, vaccines are now one of our best tools to put an end to the pandemic. And as Health Director Pat Lopez will detail in today's briefing, our vaccination program is saving lives right here in our community. You can help our community-wide effort to save lives, stop the spread of COVID-19 and its variants, and to end this pandemic by ensuring that you and your loved ones get vaccinated when it's your turn. To be notified promptly when it's your turn to receive a vaccine, please get registered by going to covid19.lincoln.ne.gov. Registration only takes a minute, and if you're over 50 years of age, now is the time to get this done. Thank you to all of our community partners who have worked with our health department over the past year to get so much done to protect our community. And thank you to all our residents who have helped prevent the spread of the virus and who are now rolling up their sleeves to get vaccinated. Here with more information on our community's progress is Health Director Pat Lopez.
Thank you, Mayor. I want to start today by stressing the importance of getting vaccinated against COVID-19 when it's your turn. The vaccine provides protection against the virus, it prevents illness, and it has saved lives. The vaccine also provides some protection against the COVID-19 variants that we have now seen in our community. Having more people vaccinated puts us in a better position to prevent new variants from emerging in our community, state. We currently have 3 safe and effective COVID-19 vaccines, and we encourage people to get the first vaccine that's available to them. More than 97,000 people have received first doses so far, and 50,765 people are fully vaccinated. That's just over 20% of our county population 16 and over. Last week, about 22,000 people were vaccinated in our community, including about 18,000 people at our first 3 large-scale clinics at Pinnacle Bank Arena. With basketball season concluded, we have a new clinic layout in the bowl of the arena. This enables us to have more than 50 vaccination stations and a larger post-vaccination waiting area. We have largely finished Phase 1B. Residents age 65 and older, and the rest of the priority worker groups, including educators, child care providers, funeral home staff, as well as employees of food processing facilities, the transportation industry, and the U.S. Postal Service. Another important group in Phase 1B who received vaccines last week are our employees in our grocery stores. Joining us today by Zoom is Ansley Fellers, the Executive Director of the Nebraska Grocery Industry Association, who will tell us what these vaccinations mean for the workers and for the industry itself. Ansley, thanks for joining us.
Thank you, Director Lopez. And thanks a lot to the mayor. Would you like me to continue now, or do you want me to turn back over to you?
Yeah.
Okay. Great. Well, thank you. As everyone here probably knows, early last year at the start of the pandemic, the grocery industry was deemed essential. And while it was certainly a stressful time for our employers and our employees, there were a lot of unknowns originally. With the guidance from health professionals and local and state officials, the grocery industry led the way in implementing some of the best practices we still see today. And I won't go into those, but if anyone has questions about what grocery stores are doing to protect their employees and protect their communities, and some of the changes that we've seen over the last year, I'm happy to address those. The industry was really quick to respond, and we're really proud of our stores and our employees, from larger stores with multiple locations to our smaller independents who met all kinds of demands over the last year and continued serving our communities of all shapes and sizes. Now with the vaccine rollout, there's been a huge sigh of relief. Along with other frontline workers, we're so thankful to see the grocery industry workers being vaccinated, especially in our two largest counties in the state. We're obviously aware of and sensitive to the fact that many retailers rely on folks showing up every day to stay afloat. And so we're hopeful as the state sees more and more doses that anyone who wants a shot will get them as they become available. But in the meantime, we're just really grateful, and we're going to continue showing up every day to serve our communities. We can't, again, thank the director, thank the mayor, thank the health department enough for getting folks vaccinated, getting anyone in these stores. I know there are a lot of folks who have had a lot of concerns over the last year. They've been available and forward facing for so long, and we just, like I said, are very grateful, and I'm happy to answer any questions if anyone has them, but thanks for having me today.
Thank you, Ainsley. Getting vaccinations to this critical group in our community is another huge step forward. At our clinics last week, we were able to start vaccinating residents aged 63 and older on Thursday and Friday. That was the beginning of Phase 2A, which includes residents aged 50 through 64 and those with serious health conditions determined to be at high risk by our local health care providers. As we did with age 65 and older group, we will be vaccinating the 50 through 64 age group in age increments, starting with the oldest residents. If you are age 50 through 64 and you have not yet registered, now is the time to complete this simple process. As the mayor mentioned, you will find the secure online form at covid19.lincoln.ne.gov. This form is available in English and Spanish. And those who do not have online access or who need assistance may call the COVID-19 hotline at 402-441-8006 to register. The health department also has interpreters available to assist callers who speak other languages. We are holding 2 large-scale clinics this week, both at the arena. On Thursday, we will have a first dose clinic for those aged 59 and older. On Friday, we will have a second dose clinic for those residents aged 70 and older, as well as educators. Moving to 2 clinics this week is necessary to make sure we have vaccine supply available for our second doses for those people who turned out for our very large first dose clinics in recent weeks. We are also partnering with Bryan Health and CHI St. Elizabeth and Lincoln Surgical Hospital to hold upcoming clinics for people with serious health conditions. The health department has been working very closely with our local physician to identify patients. 2 weeks ago, several guests joined the mayor and me to talk about the collaboration between our community cultural centers, local churches, and the health department to host some smaller scale vaccination clinics to help provide vaccine access for members of our community who've been disproportionately affected by COVID-19. On March 30th, we will hold a second dose clinic in collaboration with the Asian Community and Cultural Center. We are planning with Mount Zion Baptist Church to hold a clinic March 31st at Mount Zion. And on April 12th, we are partnering with El Centro de las Americas for a clinic at the Center for People in Need. The centers and churches are assisting individuals with registration. More small clinics are being planned, and we will share dates and locations as they become available. As more and more of our residents are vaccinated, I want to stress the importance of continuing to protect yourself and others even after you're fully vaccinated. You can be considered to be fully vaccinated 2 weeks after receiving either your second dose of the Pfizer and Moderna vaccines or your single dose of the Johnson & Johnson vaccine. Being fully vaccinated does allow people to start doing some of the things they have stopped because of the pandemic. According to the guidelines from CDC, fully vaccinated people can safely visit with each other. Fully vaccinated people can safely visit with low-risk, unvaccinated people from one household at a time. While being vaccinated greatly reduces your chances of getting sick from COVID-19, you can still be a carrier of the virus. That's why it is critical that all of us continue to take the steps to protect ourselves and others until enough people have been vaccinated. Please continue to wear a mask, watch your distance, and avoid the 3 C's: crowded places, close contact, and confined spaces when in public or if visiting with unvaccinated people from multiple households. Now to move to our risk dial, most of our local indicators continue to remain flat. So the position of the risk dial remains at mid-yellow for the 6th straight week, indicating a moderate risk of the virus spreading in our community. New weekly COVID-19 case numbers have now been between 324 and 343 for 6 consecutive weeks. For the week ending March 20th, 327 cases were reported. Again, we need to continue to take those simple, common sense steps to prevent the virus from spreading in order to keep our numbers low and not reverse our progress, especially with the variant strains circulating in our community. Our data is now showing the powerful and positive impact of the vaccination program. Throughout the pandemic, we have seen our older residents be the most at risk for serious illness, hospitalizations, and death from the virus. 87% of our deaths in Lancaster County have been in residents aged 60 and older. That is why it has been so important to vaccinate our older residents first. Most of the vaccine administered in Lancaster County has been in the arms of those 65 and older. The new chart on the dashboard shows the percentage of the local population that has been vaccinated by age group. As the mayor mentioned, we have now vaccinated over 75% of our residents age 65 and older. We also know that vaccinations are contributing to lower case numbers and lower local hospitalizations, as we have been sharing for many weeks now. We can see that in the percentage of new cases in our residents age 65 and older, especially. In January, the age group made up 10 to 15% of our total weekly cases. In February and so far in March, the percentage is less than 5%. This past week, ending March 20th, we have had no new cases in our residents aged 75 and older. We also continue to see a decline in the number of COVID-19 patients hospitalized locally. In January, the daily average was 90 hospitalizations. So far in March, the daily average is now 28. Today, we are reporting 20 hospitalizations, with 13 from Lancaster County and 7 from other communities. Finally, as the mayor said, our data clearly shows that our vaccination program is saving lives. This is the ultimate desired outcome for our efforts to prevent new cases and hospitalizations. This chart shows the bell curve between September of last year through mid-March. We experienced a peak with 74 deaths in December. Well, every death is a deep loss for our community. So far this month, the number of deaths is down to 3. We have worked hard as a community to efficiently vaccinate as many members of our community as soon as possible, with an emphasis on those who are most at risk. This data shows that our efficient vaccine program is proving to be very effective in reducing new cases, hospitalizations, and deaths. With that, we'd be happy to take questions from the media.
Director Lopez from the Journal-Star.
Hi, Riley.
Hi, Pat. Could you talk a little bit about the expectation for Lancaster County to get to a point in its vaccination phase where every adult, or really anyone 16 and older, would have the ability to schedule a vaccination? I know a lot of states, including neighboring Iowa and other states like Texas, are getting to that point now. Is that a few weeks out yet before we'll have the supply to get there?
One thing, I do know right before I came here that we had information from the state, our Moderna, which we aren't receiving, is the same, but our shipment for next week is the same at the 8190. So how fast we move is really dependent on how fast we get vaccine and how much we get. We're definitely a few weeks out yet, Riley, but we're continuing to work with our pharmacies, Rely Care and Hy-Vee, to be in sync and moving forward together, and that's helpful related to the doses of vaccine they're getting. So it's really hard to say. We have a large population between 50 and 64, and so as we move down, we're going to continue to do what we've been doing incrementally.
Are there other questions from the media? All right. Well, finally today, we do want to remind residents that help continues to be available for those who need housing and utility assistance. Lincoln recently received an additional $13.4 million in federal funds to help individuals and families cover not only current costs for rent and utilities, but also to eliminate past housing and utility debt. We want to urge those who need help with housing and utility costs due to the pandemic to apply for assistance using the new online form at lincoln.ne.gov/rent. You may also call 402-413-2085 for assistance. More information and the application forms are available both at the website and if you go to the resident resource page at our COVID website, covid19.lincoln.ne.gov. Response to our new online portal has been significant, and since last Thursday when we announced the additional funding, more than 200 applications have been processed and close to 400 are pending. Our community is doing a great job of getting these federal dollars to those who need them the most. And in closing, I just want to say thank you to Ansley Fellers from the Nebraska Grocery Industry Association for joining us today. And thanks again to our health department and all who are partnering with us in this effort to get vaccine into the arms of our community members as efficiently and equitably as possible. Again, registration is a very important part of this effort, so please sign up to get notified when it's your turn to get vaccinated. Together, we will bring an end to this pandemic. Thank you.